So let's just go ahead and get started here. All right, so we are O'Neill Marketing. We are a national general agency that has headquarters in Tampa, and we focus on health insurance. Today we're going to be going over the basics, how to present to a client, and how to build your business. This is primarily for new agents, not that existing agents couldn't get some good parts throughout this, but it is going to be really geared towards the new health insurance agent. We're going to start by just talking about the setup, getting started with O'Neill Marketing. Most of you have probably gotten our Get Started email. We're going to go through that. Many of you probably completed that, but we just want to start from the beginning. So then we're going to move into selling. We're going to have a couple of examples that example clients that we're going to go through, kind of the sales process, finding the right plan, utilizing the tools that we have to find the right plan for the client. We're going to go over a number of different resources that we have available, that you have available in order to be successful in finding the right product for your client, presenting yourself with professionalism, and having an overall high quality interaction with your clients. And then we're going to talk about some growth strategies. All right, so most of you, hopefully a lot of you guys have already taken care of the initial tasks that we've set for incoming agents, but we're going to go through those here. You've probably all gotten this email either from myself or from Matt with the 9 steps to get started with O'Neill Marketing. We usually want our agents to kind of work at their own pace to get this stuff done, a lot of basic stuff, just to get the paperwork and basic training kind of out of the way so that we can focus on more high-level content when we do our one-on-ones. So let's start from the beginning and getting set up on our website by creating an agent account. So you'll be able to have access to all of our tools that are not only available, or that are only available on the back end of our site. So we'll go over our website features here in a little bit, but just as far as getting registered, basically you're just going to hit the Join Us at the top of the screen. That'll take you to our agent registration portal, and from there you just register. We will get a notification to approve your account. From there, you'll have full access to our site. Step 2, getting your E&O. This is very important for all insurance agents to have. It's basically insurance for insurance agents. Make sure that you're not putting yourself at risk. Mistakes do happen. Hopefully, with the proper training and support system to turn to, if something's not adding up, you'll never have to use this. Knock on wood, I haven't heard of any of our agents having to use this, but basically all carriers require it, and it just provides coverage to you, to us, to the insurance carriers, that if there are mistakes, that you're covered for that. We really like to use NAPA. It's typically around $35 per month. All right, and the producer agreement and profile. We need this primarily in order to get you contracted with the insurance carriers. It gives us information that we need in order to start the contracting process. Typically, when this email is sent out, that will trigger our contracting department to send that producer agreement and profile. It'll show up in your inbox from DocHub. So go through that, sign the document, fill out the producer profile with your NPN, FFM ID. It'll ask about different carriers you want to be appointed with, license numbers, all that stuff. And that will allow our contracting department just to work more efficiently. Step 4, sending documents to our contracting department. Basically, just send your E&O, voided check, insurance license, so we have everything on file, and our contracting department again can work efficiently. It doesn't have to go back and forth on some of the basic stuff. Downloading the RingCentral app. This is really important for us, again, to allow us to work more efficiently. This is what we use for all of our webinars, for all of our screen sharing with agents. If you're doing any one-on-one trainings, we're going to be using this RingCentral app. So, save everyone 5 minutes that it's going to take to download the app and get all this up and running. So doing it ahead of time, you guys are already on this webinar, which means you've already done that. So you're off to a good start. Whitelist our domain. This is another big one. Hopefully you guys are getting all of our emails. If for some reason they're going into spam, please use our whitelist instructions to avoid that from happening in the future. It takes about 2 minutes, and we just want to make sure that you're getting our emails and our updates so you can stay on top of new things that are happening. Getting certified to sell ACA Marketplace and Medicare products. So we got to knock this out ASAP. Make sure that if you have not done so already, that you go to portal.cms.gov and complete your ACA training. For new agents, it takes about 4 hours if you go through it from the beginning. If you're a returning agent, basically there's 2 modules, a little quiz, 10 questions, and that's about it. So you can typically knock that out in about 15 minutes if you're a returning agent. If you're a new agent, there's a lot of really good material, good content that'll help you be successful and understand the marketplace and the plans on it. There's also a link to our website that should be in these Get Started emails as well that'll walk you through that process. Setting up your Health Sherpa account. Most agents use Health Sherpa for all ACA enrollments. It's basically like the skin for healthcare.gov, makes things a lot simpler. It also looks better if you're doing screen shares with clients. I think aesthetically it looks a lot better than healthcare.gov, but it will basically function in every way as good and in a lot of ways better than healthcare.gov. It allows you to complete the application quicker, but it also syncs and allows basically full integration with the CRM within Health Sherpa. It will link all your clients, or basically link to all your clients' healthcare.gov accounts, basically letting you know if there are any tasks that need to be completed, any documentation, making sure that payment is all taken care of. 95% of our agents are utilizing Health Sherpa, and that's basically what we train on. So in order to set up your Health Sherpa account, you're gonna follow the steps. Again, we do have another guide that's gonna be on our website. And you're going to want to use our agency join code. That join code's 6334. Whether you're creating a personal individual agency account or agent account or an agency account, you can still link to our agency. Just go to your settings, put in our agency join code, which again is 6334. And number 9, scheduling and onboarding meeting with our team. Before we get into one-on-one trainings, we really want to make sure that 1 through 8 are all taken care of. Hopefully you guys can understand and appreciate that. We've tried to make it super easy for everyone to get the information they need so that our team doesn't kind of get bogged down by setting up 50 agent CRM or CMS portal every week. So we want our agents to get familiar with a lot of the tools that we're using, and then try to focus on more higher level things, customizing strategies, making game plans, specialized specific training that might not be covered with the basics. You can click on the link there in number 9. That'll basically set you up on our calendar, pick a time that works for you, and we can get ready. All right, utilizing our website. We're going to kind of go over a little overview on our website to get you familiar with it. I'm going to start by getting onto this PowerPoint here, and we're going to go over to our website. So after you've registered, you'll be notified. It'll notify us, we'll approve your account, and then you'll have access to all of these pages up here. Now, there's 3 things that I really want to go over as far as tools and resources on our website. We'll start from the left to right here. So on the agent page, this is something we've been working a lot on. We'll continue to do so over the next couple months here. We've added a lot of features since last year, and kind of want to maximize those over the next couple of months. We will be making some changes in the month of October, especially down here on the file section, to help you work more efficiently, give you more resources. So everyone's got this agent page. It's automatically created when you create an account with us. You're going to have access to our support ticket features. This is a really good tool that allows you to send information to us that you might need help on, whether that's assistance with an application, product training, commission inquiries, appointment requests, anything like that. You can submit a ticket, and that way it just minimizes the possibility of us missing it or it getting buried in an email. This will notify everyone on our team that you need something, and allows us to, stay on track, reply, and keep the process rolling without it getting lost. So definitely highly encourage you guys to utilize this whenever possible. Everyone has a built-in support ticket. Let's go back here. All right, so everyone's got a landing page. So you can use this basically however you'd like to market to your clients. You can replace our logo here with one of yours. It's going to have a button here that'll go directly to your Health Sherpa account. So that basically if clients click on that, they will go right into your Health Sherpa account. If a client plugs in any of their information, it'll be automatically populated in your lead section on your Health Sherpa account. And then there's a contact form. So again, if your client plugs in any information here, it'll be sent immediately and only to your email address. So let's go back to the dashboard here. You're going to be able to modify your account and your settings here. If you go to edit profile, you can basically upload a photo, fill in a bio, include your phone number. You can override our logo here with yours, and then include your Health Sherpa link or any link that you want that button on your agent page to go to. You've also got the ability to schedule a meeting through here, view training videos, And this one's linked to our commission statements or your commission statements. We've got industry news, our company news, a to-do list, and we've created a file section as well that we'll be providing certain resources to our agents with, such as carrier documents, digital marketing, artwork that we've created. All right, the next thing on our site that I want to highlight is our products. This is going to include basically almost every product that we have. Some of the newer ones might not be on this yet, but over the next couple of weeks, we will be including, making sure everything is on it. If you ever have any questions about a certain carrier, a certain product line, your best bet is to really start here. So let's say you want to learn more about how to write a critical illness plan through National General, right? So we're going to go to the National General site. And our page here, we've got videos, links, brochures, flyers, and basically everything to help you out, find the answers you're looking for. Another thing to keep in mind is if you ever need someone's contact information, you need links for quoting, you need links for back office, all that information should be in here. Like let's say you're having some issue with Ambetter. You're on the phone with a client, something's not working properly, maybe the payment's not going through, and you need to talk to member services or even broker services. Again, you're going to have all of those numbers available right here on the website. Okay, we put a lot of work into filling this website with content to make everyone's lives easier. So please utilize our website. If for some reason you can't find what you're looking for, the third and final thing that I want to highlight here is the search function. Okay, it kind of hides over here on the side, but basically it will search all the content that we have on our site. So let's say you're having trouble with the FFM certification and need to find the FFM guide, search for that. And there you go. Okay, so utilize our website, utilize our search function. Okay, let's go back to the PowerPoint here. Okay, so you've got your license, you've done your FFM certification, you know how to use our website and find the information that you're looking for. You've worked with their contracting department to get appointed with a number of carriers, and now it's time for you to talk to your first client, right? Now, before I go any further, I want to make an important note. Some of this that I'm going to go over may sound a little like common sense. Some of the basic sales practices sound so basic and obvious that sometimes they're overlooked, and their importance is really underappreciated. Believe it or not, it's really the most basic and common sense steps where we see the most agents fail. And I think maybe that's because, we're looking for shortcuts. A lot of times in this industry, we succeed with shortcuts. A lot of times the shortcuts make us feel like innovators or whatever. But, the foundation of how sales works, the basics, building relationships, checking in, following up, asking for referrals. You cannot skip those steps and call yourself a salesman. So, if you build on the foundation, if you make these afterthoughts a part of how you operate, where it's automatic, involuntary, it would really be impossible not to succeed. So let's talk about the steps for presenting to a client. Step one, building rapport. Again, this one might seem like common sense, but it's more often than not the most important step. More often than not, this step will be the difference between closing the deal or not. And it's certainly the step that will determine if you're going to get their business again next year. Okay. So don't be a robot. Don't go straight into business mode. Get to know the client. You don't have to shoot the shit for 20 minutes and sacrifice efficiency, but you've got to build a level of comfort, right? We want to build a relationship with the client. We're going to be talking about a lot of personal information with the client, and we really want to break the ice and build a foundation of trust. Okay. So, we want to let the client know that we're meeting with them in order to help them, right? The goal is to educate and to advise them. One good way to do that we found is screen sharing with the client. Okay, so that's something that, we're going to talk about here in a bit, but it's something that I think adds a lot to a presentation, especially considering, now more than ever, a lot of conversations and sales are going to be done over the phone. Allowing the client to actually see what you're seeing and see how you work and react to the information that you're going to be gathering, I think it's pretty important. You don't want to have a barrier to your communication. And I think screen sharing is an extremely useful tool that everyone should be utilizing. Step two, gathering information. So let's start with the easy ones, right? Age and zip code. Next, ask about pre-existing conditions, past healthcare experiences that they've gone through, anything that we need to know about their past that can help us provide good recommendations and really understand the best options for their specific needs. What's their healthcare usage? Okay. How many times did they go to the doctor last year? Are there any upcoming healthcare events that they've been thinking about? Any procedures that they know they're going to need at some point in the future, even if it's not, right around the corner? Maybe it's a few years out, like a hip replacement or something like that. Those are good things to know. This is also a good time to talk about dental and vision or even critical illness. You really don't want to wait to talk about ancillary products until the very end. Right? The client thinks, great, we did this, we're all done. And then you throw additional things at them. I really like to mention dental and vision and maybe even some supplemental products in the beginning, not just at the end when you're almost done with the presentation. Another thing to talk that's important to talk about with the client is their motivation for getting insurance. When you've, some of the different past experiences they've had, maybe let's say they've been uninsured in the past and gotten stuck with crazy bills. Maybe they've got a procedure coming up and they want to make sure that they can save money on that. Maybe it's just basically that they're responsible people and you've got to make sure you're covering yourself and, for the safety of yourself and your whole family, right? So really, what's driving them in the first place? That's good to talk about, good to understand to help you formulate your game plan. Next, we've got household size and income. Keep in mind that we need to understand the client's taxable household size and taxable household adjusted gross income. While, it might be useful to know if there's any unique situations regarding their household size or income, as far as ACA goes, we need to know how their taxes will be filed. And then lastly, ask about their doctors and prescriptions, right? Write all of this down because we're going to need it. Step 3, Determining the best product fit. So you've gathered all this information, and now we've got to basically stick them into one of 5 buckets. Okay, so we've got Medicaid, which is basically for the unemployed or very low income individuals. For the most part, we just really have to refer these people to the Social Security Department, who can help them get signed up and enrolled. You have ACA, which is anyone with pre-existing conditions or anyone under 400% of the poverty level. That number determines whether or not the client gets a subsidy. Okay, so let me go over here real quick. There's a chart that you can find on the CMS site. It's probably also on healthcare.gov that will show you the income levels for subsidies based on household size. So this is a very useful tool. Anything under the left column has income that's too low to get a subsidy, and anything over the right column has income too high to get a subsidy. And then the columns in between show different amounts of advanced premium tax credits and income-based cost share reductions. So basically, depending on the column, there are different modifications that happen to the plans themselves. And that's basically for silver plans only. So if a client has pre-existing conditions or is within that chart, which makes up a very large amount of people, they're probably going to be best off with ACA. When a client is in the ACA bucket, we want to start with Marketplace or Health Sherpa, and then we look at gap plans. All right. Short term, this is going to be the bucket for healthy individuals and people that are over the 400% poverty line. It really requires both of these if this is going to be a long-term solution for them. If it is truly a temporary tool to get someone to open enrollment or special enrollment period, I could make some concessions on these. But if short-term is going to be used as a long-term solution, which it can be, the name is a little bit deceiving. Both of these points should be requirements. Now, if a client fits those criteria and we're going to consider short-term medical, we still need to start with Marketplace plan. Okay, show them what it's going to be if they needed to go through the Marketplace. Then we're going to show them short-term medical options, and then again we're going to go and fill in the gaps. Supplemental coverage, that's going to be for specific coverage types, clients with cost constraints, or maybe they've got group coverage that they're looking to fill in some of their, they're trying to, fill in the gaps of their group plan. Okay. Again, always start with the Marketplace, full indemnity and MEC plans, and then supplemental. Last but not least, we've got Medicare. This is going to be for individuals 65 and up, or those with a qualified disability. With Medicare, we're always going to start with Medicare Supplement and then transition to Medicare Advantage. Today, we are going to focus mostly on these 2 buckets. Most of our business is going to be in these 2 buckets. Step 4, help your clients pick a plan. We are going to go over some of the tools that we use. It's extremely important to prepare your tools and make them work for you. We'll be going over here these momentarily. But lastly, before we go into some examples, keep in mind that practice will make you better every time you do it. Every client has unique and different needs. If everyone was the same out there, there'd be no need for an agent. The more clients you work with, the more answers you will discover. Okay, and really the key is knowing where to find the answers to the questions that arise, and the more experience you get, the faster you realize where to look. So again, the more practice you have, the more you pick up on, and the faster you can find those answers. Let's start with an example. So we've got a client here. They live in St. Petersburg. Again, these are all the notes that we're going to be taking in that gathering info step. We've got a 32-year-old male. He has no pre-existing conditions. He does use mental health services. He's a therapist. Really, his goal is to have coverage in case something bad happens, to cover his therapy sessions. He is single, makes about $65,000 a year. We've got his primary care physician, his therapist's name, and then 2 prescriptions that he's on. All right, so let's go back. Now, talking about the tools that I use, one thing I like to do is create a bookmark folder that's going to have all the websites that I like to use. Okay, so I'm going to open all 5 of these in a new window. And here we go. So we've got Health Sherpa, we've got National General, we've got a dental product, we've got GoodRx for prescription drugs, and we've got Healthcare Blue Book to help us with pricing. All right, bear with me one second while I get the quoting platform up here. There we go. All right, let's go through this client. All right, I'm not going to get too much into the functionality of Health Sherpa. There are a ton of training resources on Health Sherpa that I could do a whole new webinar on just that. So I'm kind of just gonna skip the training on Health Sherpa itself. Again, utilize the resources that are on Health Sherpa. They're fantastic. We've basically copied them all from Health Sherpa that are on our website. You can find them there too. So right off the bat, I like to, obviously plug in your client's information and then find a doctor. If they provided you doctor's information, let's go over that. All right, so we've got 2 doctors here. We've got Henry Owens. All right. Up in Clearwater. And then we've got Menez, Christina. There we go. Also in Clearwater. Great. Now, we can also sort by only showing plans that have both of these providers. Now, I think when I did this last week, Oscar hadn't updated their new doctors. So that's actually good news. We're going to ignore that Oscar does take both of these doctors because I did everything for showing that Bright did, but that is good news that Oscar is updating their broker or their doctor search. They did have problems with it last year, so that is going to be hopefully much better than it was last year. So let's ignore Oscar for these purposes, because when I set this up, that was not an option. But let's say that basically the doctors that are the plan that takes both of these doctors, and the only plan that takes both of these doctors is Bright, because that's how it was before. Otherwise, it is truly Oscar and Bright, and none of the others take both doctors. But let's just assume that it was just Bright. So right off the bat, this person's not getting any subsidy whatsoever. His income is too high. So, you know, immediately we're looking at probably close to $4,000 that this client is going to have to pay out in the form of premium. Okay, that's a lot of money over the course of the year, especially for a catastrophic plan. High deductible, high out of pocket, basically very little pre-deductible benefits. So let's take a look at this plan. All right, we do see that the first 3 visits are covered at $40 for copay. After that, it is subject to the deductible. So, okay, but actually the deductible and the out-of-pocket maxes are the same here. So again, yeah, it will be basically full price to the client until that $81.50 is met. Now they are getting 3 free visits, or sorry, not 3 copay visits at $40 a piece. All specialist visits are going to be full price. They will be getting preventative, just like all ACA plans. And then basically we see how bare bones this plan is. And that's pretty typical on bronze plans like this. All right, so very little, let's see if there was. Yeah, it looks like even prescriptions, full price across the board. So basically the only pre-deductible benefit that these people are getting on this plan is preventative and then first 3 visits. Let's take a look at a silver plan. All right, this is going to be about $100 more expensive a month, which means about $1,200 more expensive a year. We do have a lower deductible. We have the same out-of-pocket max. All right, this one does not have a limit. It will be a $40 copay right off the bat. We are subject to the deductible here on the specialist. All right, so a lot of these, again, you've got to meet that deductible of $4,700 before you're getting any of these co-insurance. We do have $15 prescriptions on generic drugs, which is nice. We have $75 copays on urgent care, which is nice. All right, for the most part, again, it's a little bit limiting because they've got to meet that deductible before they get additional assistance. You know, even let's say they go to the emergency room. They were great all year, but they get hit by a car or something, right? And they've got to go to the emergency room. Right off the bat, that's $4,700 right off the top, right? And then we're looking at 40% co-insurance for the rest until we hit that out-of-pocket max. All right, now in an individual like this, like we were showing with those buckets, this would be someone that would meet the qualifications to have us look at short-term medical, right? Relatively healthy, you know, no pre-existing conditions, and makes too much money to get a subsidy, okay? So let's just take a look at some of the short-term options. Now, one thing I do want to point out is National General just implemented something that will allow premiums to go even lower if they previously had coverage. If they had been covered in 9 of the past 12 months, they will qualify for a pretty deep discount on their short-term medical products, which is great. Something that I haven't seen with United Health One yet. And it really gives National General the edge here. All right, another good thing that I like about National General and short-term in general is the customization that we can have with the plans. All right, we can see we can change the deductibles, we can change the co-insurance, right? And there are a lot of different options. This is typically my go-to, okay? $5,000 deductible and then covered at 100%, meaning that the out-of-pocket max is also $5,000. Once you hit that deductible, which is the out-of-pocket max, they're going to be covered at 100% after that. Whereas some of these other ones, a bit less expensive, right? $5,000, but really the true out-of-pocket max is 10. Even up here, we're looking at the true out-of-pocket max being $12,500. Okay, so this is typically my go-to unless we need to modify based on premium. So this is the default that I start with, and then I allow the client to modify from there. Now, another thing I want to point out is they do have copay options. Okay, I typically, some clients, they're just hell bent on having copays, and it's just how they've always done it, and they don't want a plan that doesn't have it. And doesn't matter how much common sense that you put in front of them to show them they probably shouldn't do this. That's what they want. Typically, when we look at this, we're looking at a $50 increase per month in the form of premium. Plus, you're looking at $40 per visit for primary care. So, in my eyes, to make it truly worth it, if you're doing let's say the doctor's in network to begin with, and you're getting a 40% network discount on top already, you're probably looking at, a $130 bill maybe. You'd have to go to the doctor at least every other month to make that total outlay to actually spend less money using this copay option. So typically I try to stay away from that. Also keep in mind that's going to be a $6,000 higher out-of-pocket max with that plan. So again, they have it available. Mathematically, I just don't see how you could sell that plan. But again, it is available. They also have guaranteed issue products. Really, the only time I sell these, if someone needs guaranteed issue, they should probably be in ACA, right? If they have types of pre-existings that would require that they have guaranteed issue, it's probably not the place for them to begin with. The only time that I do use guaranteed issue is if it's truly a short-term holdover product until they get on an ACA plan. Now let's take a look at some of these. Okay, so we'll go into the plan brochure here. All right, pre-deductible benefits, they're gonna have really the biggest one is going to be, really the biggest one is unlimited use of telemedicine. So totally free, unlimited use of telemedicine, get a doctor on the phone within 5 minutes, 24/7, 365 days a year, okay? They do have a $50 access fee to urgent care. That is the one big thing that we push with short-term medical. Try to use doctors like your primary care physician less and your urgent care more. We've had clients that, their kid broke fell off a swing, broke their shoulder, and they go into the urgent care. They see the doctor, they get x-rays, they see the doctor again, they get a cast or a sling, and they walk out $50 total. Okay. Again, utilize that urgent care. That's great. So, all right, let's go. Let's check this out. Let's make sure the doctors are in network. All right, this doctor is in network. Great, that's the primary care physician. All right, now let's go back. Okay, so the therapist is not in network, okay? So what I'm gonna go through here is we can take a look with the Healthcare Blue Book, kind of how, what the kind of cost is gonna be. Okay, let's just say for an office visit, for a doctor, and then let's say, maybe I'll just click on it and then we'll go back. Oh, I gotta switch this. Office visit 206. Okay, keep in mind this is in network doctor for the primary care physician. We're looking at probably it's going to be a 40% in network discount. So we're looking at total cost for the office visit to be about $120 per office visit if they're on health or if they're part of NatGen product. Keep in mind the reasoning, okay, that National General stays away from copays, and that when they do, someone does see a doctor utilizes their health insurance with short-term medical product, that they're going to have higher bills than they would if they were on ACA, is because we're not prepaying for potential usage of our health insurance. Okay, that's the thing that we really need to, people really need to understand, that premium does matter. Premium is something that the clients need to factor in, to the point, you know, a lot of clients, it takes a little time to get used to, oh wow, I'm not used to going to my doctor and having a $150 bill. That's crazy. Well, we're saving them $200 in premium every month, right? So that's something that they need to realize and understand, and you need to articulate that to your client. All right, so we looked up that. We can also look up what a therapy session would be as well. I've done that before. It's about $230 on average, fair price in St. Petersburg. So let's say, rather than pulling it all up here, let's just say for this purpose, $130. So $120 for primary care physician, $130 to see the therapist. All right, so let's do some math. I think that's all the math we need to do. Oh no, prescriptions. So take a look at that. So again, with prescriptions, this is not, drugs are not going to be covered with short-term medical products. So another thing that we've got to take into account when we're looking at comparing these. So GoodRx is something that I share with all of my clients for ACA, even for health, for National General, but even for ACA products too. because it'll have tremendous discounts for drugs. So something like an Adderall prescription retailing, we're looking at, take Costco out of the mix. They don't have a Costco card. We're looking at $80, minimum on average. Okay, let's just say 80. I think that's what I used for my example. Okay, this one pretty cheap, say $15. And then this is what we're looking at with a free coupon. This is without signing up for anything, no subscription or anything for the client. Again, love this website, it's awesome. And then on this one, we're looking at $20, $30, $25, $30, right? So let's take a look back at these examples here. All right, and we'll kind of do the math on this. All right, so let's first look at premium. On that bronze bright plan that we looked at, it's going to be $320. On the silver, $423, and on the Nat Gen, $243. All right, with the doctors, we were capped at 3 visits on this bronze plan, unlimited visits at $40 copay on the silver, and then we were looking at about $120 per visit with National General. Doctor 2, that was going to be basically full price for a specialist, right? Same thing for Bright. To see the therapist, it was going to be full price. And then same thing for National General. All right, let's look at the prescriptions. This is going to be full price on the for generics on the bronze plan, $15 copays for both of these on the silver. So yeah, full price, good RX discount. Okay, and we're looking clearly, we can see a pretty significant advantage over here on Nat Gen, especially considering this is keeping in mind that, prescriptions are typically standard, of refill every month, but the doctors maybe not, right? This is assuming that this is going to be a standard cost every month, which is very likely not going to be the case. And after 3 visits, this one's going to go up, right? So that would just exacerbate this discrepancy even further. And then we see extremely high deductible and out-of-pocket max, and much more reasonable deductible and out-of-pocket max. So here, given the information that we have, given the fact that they are not getting any subsidy on the marketplace, my advice to the client is going to be National General. Okay, now keep in mind, if that same client had a different income threshold, that's not the one. All right, let's say he was making $30,000 rather than 65, right? He's going to get a really big savings here. Then it's a no-brainer, right? Then we bring it to the silver plan. These silver plans also, with the cost sharing reduction, will get knocked down the deductible. This is that same plan that we were looking at before, where the deductible was $4,700, out-of-pocket max $8,150. This is the exact same plan, but because of the income and the cost sharing reductions, it actually modifies the plan itself to modify the deductible, modify the out-of-pocket max. It will even modify copays and such. All right. All right, so edge to National General on this example. So let's go to the next one. All right, I'm going to try to do this a little fast because this one's pretty complex. So bear with me. Client 2, this is going to be in Los Angeles, California. We've got a family of 3. Okay, and through your conversation with the family, we have notes that the wife gets seizures. The husband has heart disease in his family. They're concerned about emergency room visits and specialist copays. The husband travels often, so he wants a good network. They make a total of $50,000. We have the primary care physician, and there is a medication that they're on. Okay, right off the bat, we're looking at ACA, pre-existing conditions, mid-income. All right. So let's go back here. All right, we're going to add everyone on here. Three-member household, $50,000. All right, now we're going to see there's pretty significant savings here. They are going to get the cost share reduction, and then the child is going to be put on CHIP, which is good. Good coverage, good network, very low cost. So that's great. That said, we still want to include the child here, because when we go through an application on Health Sherpa or a state-based exchange, and it shows that someone that is applying for coverage is eligible for Medicaid or CHIP, it will automatically submit an application for Medicaid or CHIP. Now, if we took the client off here and kept the household members at 3, we'd still get the same thing, but it would not initiate the child's application to go to the state. So unless the child's already set up, we want to make sure that that person's included. Now with the household members, this is not just who's applying, this is total household members that they'll be filing in their taxes, total household adjusted gross income. So let's take a look at the plans. Oh. Something's not right. There we go. All right, let's take a look at some of these. And where is the provider tool that should be available? Where is it? All right, I'm gonna reset it. Sometimes this gets a little glitchy. Do it over here just so I'm not sharing all my client information. All right, let's try that again. That should not be the case. It was working for me yesterday. I guess we'll have to do it the long way, okay? So let's take a look here at doctors. Find a doctor, search the network. We're still in 2020. All right, I'm gonna go through here. Let's see. Okay, so primary care. know it's in here because she's right over here. All right, so I did this earlier. She is in network, okay, with Oscar. Great. Okay. This should be working. There should be a provider link here. I'm not sure why it's not populating, but it's not. Typically it will. Sometimes this thing glitches, but don't love that. So let's look at a couple other ones. Let's look at this. Let's look at Kaiser. We'll just stick with 3 to look at the providers. Again, that provider search tool helps a lot. All right. Not sure why Kaiser won't show me the doctors. There we go. Let's try. Let me expand this a little bit more. All right, so no doctor for Kaiser. Let's try this. And we're not looking like we're in network here. Okay, so we're gonna stick with Oscar. Again, I like Oscar. Let's see if this plan also is one of these good plans that I like. This is not always the case in every county. But one of the things that I have noticed about Oscar, and again, you will pick up on things like this as you scour these summary benefits, okay, is things like this. And this is something that I think it's not only Oscar that does it, but I've seen it more often with Oscar than other carriers. And Oscar is in a ton of states. They don't do it in every state. Texas, I tried this in. They don't have this in Texas. They do here in California. They do in Florida. Do in a number of other states. But I think like the Carolinas and Texas, they don't. Maybe that's just the counties I was looking in. I'm not sure about that either. But I do like the fact that urgent care is covered at in-network level for a lot of their plans, okay? So most of the time it's not covered at all out of network. That's good for people that are traveling, right? Emergency room, that's always gonna be covered out of network. for the most part. But urgent care is another thing. If you've got someone that travels and works remotely, or you know, gets shipped all over the place for work, it's good to have something with urgent care covered at in-network level. You know, obviously most of these, I think all plans, I think it's standard now to have telemedicine, especially with all this COVID stuff going on. They will still always be able to use telemedicine wherever they are. They will also be able to use prescriptions, prescription coverage wherever they are, as long as they're using an in-network. Let's say CVS is in-network, right? There's CVS's everywhere. They don't need to be in the county or in the state that they're in to get a prescription filled. So, but I do, you know, just because they can talk to a doctor over the phone or get prescriptions refilled, it is nice for someone that travels to have urgent care as an option while they're on the road. So let's take a look at, let's just say 2 different options here. Let's look at this one that we were looking at, which is the bronze 60. And let's look at a silver plan. Let's look at this one, silver 73. All right, this is going to have a much more reasonable deductible. The out-of-pocket max is better, still relatively high, but better. Okay, none of these plans require a referral to see a specialist, which is great. We're looking at $35 copay, $75 specialist. Deductible does not apply, which is great. We've got copays on drugs. It is subject to the pharmacy deductible, which is going to be up here, $250. So this is a basic kind of a copay plan where we've got a lot of high copays for some of these things. And again, all of this immediate medical attention, urgent care, $35 copay for deductible, or per visit, deductible does not apply. And again, covered at in-network level, which is fantastic. Okay. One other thing that we're going to look at here when we're determining this is mental health, behavioral health, or substance use services. We're looking at outpatient. Oh no, sorry, this is a different one. Sorry. Let's see. What we're going to look at is facility fee. Okay, so if this the wife is admitted to the hospital, if she has a seizure and she's got to go to the hospital. We're looking at a 20% coinsurance that is subject to deductible. This one not subject to deductible. Okay. However, this is going to hit first. Facility room fee is going to hit before physician fee typically. All right, let's look at the other one for that. Okay, we're looking at 40% coinsurance subject to deductible for both. All right, that's on the bronze plan. Same thing with emergency room, right? 40% coinsurance. And this one was $400 copay. All right, so we're in this example, we're going to use these numbers. We're not going to get too much into this, but it could just, again, lean us towards the direction that it's going to. All right. We got the doctor in network. We've covered the, we're looking at things that might affect the wife. We found a plan that is going to be good for someone that is traveling, that travels often. And the medication, when I looked this up, these were all tier 1. So $16 tier 1 here, $18 tier 1 on the bronze plan. The other thing that I do also want to point out is the specialist. Okay, on this bronze plan, $95 copay, subject to deductible. However, on these plans, first 3 non-preventative visits, right, are going to be not subject to deductible. So it's going to be $95 or $65 for primary care. If she sees a neurologist, okay, that's going to be a specialist visit. If it's within the first 3 visits to any type of non-preventative, this could be office visit, specialist, urgent care, anything like that. She gets 3 of those a year. Okay, after that, full price. All right. Now, one thing that I want to look up when I'm going over this is what would be the cost for hospital admission due to seizures. I will not switch. All right, we're going to be using this number, $10,512. Okay. Now, let's go back and let's do some math. All right, looking at the bronze plan. Okay. Now, again, I'm breaking this all down to drive home the purpose that when it's all said and done, all of this is just math. Okay. It all comes down to math, and if you use your summary benefits, you can find the numbers for all of this. Okay, it isn't necessarily necessary that you put together a spreadsheet and go over all the possible scenarios, because there are infinite amount of them. Right? This is only the situation that we're writing this for. It's going to be for 1 hospitalization, specialist seeing a neurologist every other month for her condition, going to urgent care once while the husband is out of town during the year, and then each one of them going to see a primary care physician twice during the year. Okay. So basically, premium $120 for 12 months. We've got our total premium on the year. Okay. Primary care physician, $65 with an asterisk. That's only for the first 3 times for each person. Okay, that's going to account for 2 for each person. So we're sticking with the 65 times 4. Okay, the specialist, she's going to see the specialist 6 times over the course of the year. She's already used 2 of her primary care physician visits where that is not subject to deductible. That means 5 full price visits to her neurologist. Okay, so we've got whatever the cost was that I looked up previously for a typical visit in Los Angeles to a specialist that focuses in neurology, plus $95 for that additional copay. Okay, I've also got an urgent care here. The one time that the husband goes to urgent care while he's traveling, he's only used 2 primary care visits. This third one is also going to be covered at the $65 copay. All right, we've got prescriptions. It's $25, covered, or once a month, total of $300. Some of my math might be off here because I'm not sure if this one. I think it was the next one that had a prescription deductible. Anyways, we've got hospitalization here. When that happens, we need to fill in till we get to this individual deductible. Now, in all reality, I should have 2 columns here. I should have a column that will track the deductible for the husband and the deductible for the wife. I've grouped them here together. So again, my numbers are not pinpoint accurate, but they're going to be pretty close here because you do have an individual deductible, an individual out-of-pocket max, and a family deductible and a family out-of-pocket max. Okay, so we fill in until the total amount here is going to be that individual deductible. Okay, and the remaining amount, okay, is going to be $65.60. Okay, at that, we're going to be charged at a 40% coinsurance rate for the total procedures. Total cost of healthcare during the year, not including premium, $87.94. We add that to the yearly premium. We come up with $10,200 in total cost for the client. All right, let's do that on the silver plan. Okay, so with the silver plan, we've got a premium of $105, 12 months, total yearly premium $3,660. Primary care physician $35. Again, we can see them as many times as we want for specialists and primary care with their copays. Okay, again, same numbers here. Urgent care, $35. You can go as many times as you want, no asterisks. Prescription, same as before. I think these were a little off as well, but anyways, hospitalization occurs. We've got to fill in until we hit that individual deductible, which is significantly lower than the last one. We've got a remaining after we've paid that deductible in full. We've got $78.07, which is going to be passed on at 20% coinsurance. Okay, so we're looking at a much lower, right? We're looking at over $3,000 less in total costs throughout the year in healthcare costs. However, we do have a, almost $2,000 difference in premium. Okay, and total cost $88.51. So pretty significant amount less on the silver plan, even though the premium was much higher. Now, keep in mind, all of this reality is this could be much higher, this could be much less, depending on what happens, right? If there was 2 hospitalizations throughout the year, definitely the silver would be the better place to go, right? It really just depends, okay, is if the guaranteed cost in the form of premium, right, is worth the potential risk of actual usage, okay? So typically someone like this, where they've got a much lower deductible and out-of-pocket max, and they have some serious conditions that need to be considered, I'm typically going to be leaning on the silver plan. All right, so we can do these all day. We'll have a whole bunch of new ones that we'll do over the next couple weeks here. We'll be putting in a lot of different examples. We could do these all day, but again, the more this is going to be a real client for you, right? And you're going to learn a lot by going through this and breaking it all out. And the more you do that, the more comfortable you are with it, the more you know where to look for those answers. But again, it really helps to have your tools set up for you ahead of time, okay? So utilize these tools so you know how to get the answers you're looking for and that your client's looking for. All right, so that's it for examples. Let's keep moving. All right, so we've got a plan, and now step 5 is to fill in the gaps. All right, hold on. There you go. So we've got to look at We want to talk about any accident, critical illness, dental and vision. We've already probably brushed on this, hopefully with the client, but now we've got to fill in some of this stuff. So the carrier that I'm comfortable with right now, most comfortable with, is National General. I really, really like their accident plans. Again, just because I use National General doesn't mean you have to use National General, but you should have something that will help fill in some of these gaps. I know Aflac's got a really great product. There are a number of other carriers that have fantastic accident and gap plans. Highly suggest finding the right one for you, finding the one that you believe in, that you know inside and out, and that can be part of your go-to. At the very least, just for quoting, getting a price estimate. If we've got to adjust because of certain scenarios, or we've got to move to a Washington National or United Health One product, that's no problem, right? But I still like to start with National General to give myself and the client an idea of what we're doing, what we're talking about. So my go-to is that I'm always going to be throwing on basically any plan I'm selling, especially a short-term medical, but even an ACA plan. I sell this on most ACA plans. Okay, it's going to be the plan enhancer with National General, AME plus sickness and hospitalization. So any hospitalization due to sickness. So accident, any type of accident is going to be covered, and any type of sickness that results in hospitalization will be covered. Okay, so we're trying to fill in that deductible, right? So let's take a look at, let's go back here real quick. The deductible for the plan we'd like, the silver plan, okay, we're going to be $6,500 for the individual out-of-pocket max, $3,700 for individual deductible. Family is $13,000. So let's take a look at what we got here. So a lot of these, it's actually not lining up quite like sometimes it does, but like this is a ACA deductible, $9,500. Or sorry, $7,900, $7,950, or sorry, $7,500. This is a big one, $8,150. That is an ACA deductible and out-of-pocket max for a family of one. That's really why I like these plans. It's because they line up very well with deductibles and out-of-pocket maxes. So the client's not paying for a $10,000 policy when they're really only going to use $8,150 of it, because that's what their out-of-pocket max or deductible is. So in this scenario, probably going to look for something around the $6,000 mark that will clear the individual out-of-pocket max. Now, keep in mind, this is not going to cover, the accident will cover, or these plans will be available for the husband. The accident will be available for the wife, but because she has pre-existing conditions, she's going to be excluded for the hospitalization due to sickness. You know, this would not come in and fulfill a deductible based on the situation we had with hospitalization due to a seizure. Nonetheless, it's still can help with the unpredictable, right? Stuff that hasn't arose, or if there's an accident, because a lot of times someone's really racking up bills and they don't have pre-existing conditions. A lot of times it's going to be an accident. So this is typically the plan that I'm going to add. $6,000 AME plus sickness hospitalization, $26 a month. Okay, deal when we're talking the value we get here. Okay, let's take a look at the other one real quick, where we're looking at a $5,000 net gen, you know, or even again $8,150 right there, right? This was a healthy individual, again $8,150. That's a number right there. Let's look at sickness hospitalization, if we were going to throw that on, $33. Again, okay, so I apologize. This is all set up for the 32-year-old male. We didn't change it for the family of 3. So that 22 we were looking at is not accurate for that family. However, the point's still the same. It's going to be significantly higher than that. Probably going to be somewhere in the $70 range for that $6,000 AME plus sickness hospitalization. Nonetheless, it's still a really good coverage gap plan that will take a deductible or out-of-pocket max from extremely high all the way down to $250. So something that I always try to throw on all my plans. And if you add this, you add a dental product. I really like Emeritus, really easy to use. They give you a personal link as an agent, you plug in their information, start it whenever you want, see the plans, sign them up. Also got a pretty good vision plan, right? Pretty decent. And the commissions are pretty good on that too. Again, if you need to be talking to people about gap plans and other insurance. Dental and vision is great. Increase your commissions by 50% or more by talking about this. And really, especially with ACA, the deductibles and out-of-pocket maxes are so high. It's a very easy sale, especially when you've got let's say a client that gets a very large subsidy. Some of these Brown plans are $0. But they're going to have extremely high out-of-pocket max and deductibles. Fill in that gap. Help them get that deductible and out-of-pocket max down in case there's an accident or a sickness. And you can really, I've had, in my experience, been a very easy sale because no one wants to be stuck with that 8150 or whatever the deductible or out-of-pocket max is. So for 20, 40 extra bucks a month, it provides that peace of mind. All right, let's keep going. How are we doing on time? Not great. Sorry this is taking so long, but the examples do chew up a lot of time here. So again, critical illness is another one we can talk about. Life with living benefits. I really like that specifically for individuals with short-term medical. The living benefits is a great portion that kind of fills in. I actually like to sell it above critical illness. Critical illness is an easy policy to sell, but life and living benefits, I think you really get more bang for your buck as a client. So I try to sell that. All right, so complete the applications. We're not going to go into those processes in this webinar because there are, like I said before, a ton of resources out there to help you get trained on using the enrollment tools like Sherpa and NatGen. There is training on our website right now on both of those. So I'm not going to get into that right now. Anyways, moving on. The plans have been chosen, the applications have been submitted, and things are wrapping up, okay? Ask for referrals. Referrals are extremely important, okay? I do like to do kind of a soft ask at this point towards the end. You've helped this client out a lot. You've given them a ton of new information. You've spent time with them. You've signed them up for a plan, and they're happy with you, right? What I like to say is basically, feel free to give my information to anyone that may need it, right? If you do a good job for your client, they will want to do something for you, okay? Make sure that they know that you can help the people that they know just like you help them. Another thing that we've started to do is sending digital business cards. We use a company called Haystack. You can get it for free. Just go to Haystack, sign up for digital business cards that you can email, text, or post on social media. I always send one to my client so they can then send it to other people. The next step is to send a follow-up email. This is very important. Once you're done with the sale, that's truly where your job starts, right? You've got to build a business. Building the business is everything you do when you're not in front of a client, right? If you're trying to build a business, you have to make sure that you're doing the important things, like sending follow-ups and asking for referrals, okay? I always follow up with my digital business cards and an overview of everything that we've went over. I make sure that they have the documents pertaining to the plan. You want to make sure that they have the summary of benefits, any plan brochures, and then, you know, when you give them the plan brochure, make sure your information is attached. You know, this gives you a great opportunity to mention that, again, you are able to help their friends and family. Make sure your name, email, and phone number is on every piece of material you give to the client. And, you know, a good time to mention that your business is built on referrals. Schedule one month check-in. When you write a plan, it's very important to check on the status of your client's application. You want to make sure that they're paying the premium and that all required documentation has been provided to the marketplace or the insurance company. Call the client to ask how everything's going. Let them know the status of their policy. If they need any additional coverage, reinforce the referrals, and again, thank them for their business. All right, growing your business. The best tool for growing your business is leveraging your current book of business. In this industry, agent-client trust is everything. Trust is the only thing that separates you from any other agent, okay? Leverage the trust that you've already worked hard to build. Another important thing to do is to reach out to your book before open enrollment, right? Don't let the first time your client hears you be November 1st. Early September is really when we tell agents to start talking to their existing book. If you haven't reached out to your clients yet, do that right away. Remind them about their current plan, any upcoming requirements, and, you know, reassure them that you can make sure everything will be taken care of going into the next year. If you're waiting until November to reach out to your clients, you're wasting valuable time that can be used to generate new clientele when open enrollment comes, okay? It just makes you more efficient. Leverage your book and talk to your clients early. All right, I know I sound like a broken record at this point, but the goal, again, is to build a referral-based business. I've said it probably 4 or 5 times now. When you do a good job and you help other people, they will want to help you back, okay? Once you make a sale, you've got to maintain those relationships and you've got to ask for referrals. Keys for success. Building a relationship. I think I've hammered this one enough at this point. Demonstrate expertise. Sell through education, okay? People want to know what they're paying for. You know, it's really your responsibility to be able to be well versed in all the products you sell. The more familiar you are with the products, the better you can educate the client. The more the client knows about their plan, the more confident they'll feel about their choice. You know, that said, you also have to give a recommendation, right? We do want to educate, but we do need to advise. And again, you do want to deliver that advice with confidence. When you show the client that you have a process and you walk them through how you got there, it shows your client that you are an expert in your field. Okay, always be efficient, be prepared, be organized, have the materials. Utilize technology. Everyone has a phone and email. Send them information and your contact details. Be a resource. Again, pick up the phone, follow up, answer emails, help their friends and family. All right, next, we've got a couple slides that Chuck, our president, put together. These are some of his most important points that we just want to hammer home. Here he's basically talking about being prepared and making a plan. All right, so number one, you want to be committed to the products and the process. You've got to have a process that you're going to follow. You've got the products, and you've got to be confident in those, okay? Those are very important. If you don't have confidence in your products, your client won't feel confident either, right? They need to feel the confidence, and that comes from you. Like I said before, reach out to every existing customer personally, do it ahead of time, make sure that they're happy, see if you can add anything new, or if they're okay with just renewing. Again, ask for referrals. Select a target group to expand your base. Okay, within your community, in the neighborhood, at church, at a local store. Maybe you want to target or create a niche with a restaurant employees or construction workers, okay? Get uncomfortable. You're in sales. Sometimes stepping out of your comfort zone is a good way to break into a new market. Always strive to find new people and network with them. Number 5, flood the market. Okay, most of the time, sales is a numbers game. It really is. Try to get in front of as many people as possible. I know it's cheesy, but the more people you talk to, the closer you are to a new client. Have strong marketing skills. Build a template and hammer home your message. Utilize technology and email automation to help you do this. The next one's really big. Answer your phone, right? If a client's calling you, they might be freaking out about something. If you're there for them when they need it, they will feel that commitment. Number 8, don't be pushy. This is kind of the line that you have to tread, right? If you've got a process and you show them your skills and you show them that you're working for their best interests, you shouldn't have to be pushy because they will trust your judgment, right? Last but not least, make the extra phone call. This goes back to what I was saying about the foundation of sales, right? Hard work pays off, period. You'll be better off. You'll feel better about your effort, and your wallet will feel better too. All right. A couple other things to consider. Okay, referral incentives. Some of our agents, will do things like Starbucks gift cards. So basically, like they incentivize their clients to give them referrals. So we've had some clients that say for every 3 referrals given, they get a $5 Starbucks gift card. You can send e-gift cards out right online for Starbucks. Okay. Networking is a big one, like we mentioned before. Join some networking groups like the Chamber of Commerce, Masterminds group. Eventbrite is a really good website that has a bunch of local events that you can go to. LinkedIn is also a great way to find business and link up with people, connect with new people, through your existing connections. Lastly, always give your business cards out. That is very important. Again, you should always be trying to network. All right, organization is key. For any effective attempt in growing a business. Okay. You should definitely have some type of CRM. There's a pretty good CRM inside of Health Sherpa for your ACA business, but if you're selling other products, you should certainly have another CRM. All right. Hubspot has a lot of features. The basic version is free, which is great. Really, the only complaint that I've heard about HubSpot is that the price does jump as you start to add more features and automations. But really, the options are endless with HubSpot, and the layout's pretty nice. Another good CRM is Active Campaign. This is really good for email automation. So getting people into your campaigns, into your sales funnel. Active Campaign is a great way to do that. Stay on top of your clients via email. Next is Pipedrive. This is what we use. We love Pipedrive. It is insanely customizable. Okay, it's really the most customizable CRM out there. Sometimes that can be a bad thing because it does take a lot of work to get set up, and it can be a little daunting just how many options you have. But if that's something you're looking for, it really has endless potential. Pipedrive is where it's at. Another really nice CRM is Agile Crm. It's basically a free product. It's got some limited automation, but you can basically use it extensively for free, all the way up to 1,000 contacts. Now, I should have brought this up in my examples because that really should be the first step when you're talking with a client, and I apologize for forgetting that. I did it yesterday as well. But finding the right screen share program is really important. I personally really like Crankwheel. That's what I primarily use when I'm presenting to clients. It's super easy to use. It's an extension that goes right on Chrome. It pops up. Let me show you real quick here. All right, so I've got it over here. You can click on it. For some reason, it pops up on my other screen. All right, you can share your screen. Again, that's popping up on my other screen. All right, but basically, you can plug in their phone numbers. You can send the link via email or text, which is really nice for clients that aren't in front of their computer right away. Nothing to download. It's an all web-based screen share. So I use this a lot and I love it. That said, Crankwheel is really only a one-way share, whereas these other two have much more functionality in terms of like sharing control and viewing capabilities. Still, I use Crankwheel with clients because it's simple and I don't need all those features when I'm talking with a client. I really just need the client to see my screen and that's it. And the easiest way for them to do that without having them download anything, and they can do it right on their phone. So. Digital marketing. Okay, first things first, you're going to need a landing page. You already have one with us, right? You've got a marketing link through your Health Sherpa account. And also now it's easier than ever to build your own website using platforms like Wix. Okay. Next is content and artwork. Content. That is the name of the game with digital marketing. Okay, we love Canva. It's super easy to use platform. You can basically create anything from banner ads to business cards. Really, truly can't say enough good things about Canva. We use it constantly. Videos are also very important in digital marketing too. Videos will take you really to the next level when it comes to digital marketing. We use promo for our videos, and again, super easy to use platform. Building an online presence. Definitely a must-have is setting up your business on Google My Business. This will allow people to find you and just build that online presence. Then set up an advertising account on Facebook and for Google. You know, there are thousands of videos out there on YouTube to help you get set up with those. These are a couple of our ads that we built on Canva and use for Facebook and Google ads. Basically, when someone clicks, it goes straight to our Health Sherpa account. Last but not least, there are leads. Okay, we do have a couple of companies that we recommend on the lead side. We are going to be having some internal leads this year as well. We are building a call center. There will be more on that next week. But there are some third-party platforms out there that we feel comfortable recommending to agents. Most lead companies we do not feel comfortable recommending to agents, but Smart Financial and Datalot are two that have shown over time to have some level of consistency. Okay, Smart Financial in particular has a really nice platform. It's very user-friendly, and it does allow you to return bad leads if you get some. Overall, you know, with Smart Financial and Datalot, I can say that they're not terrible, which is about as good as it gets with lead vendors. You know, one thing that I do want to stress when we're talking about leads is that they really shouldn't be used first and foremost. Okay, this is another thing that many agents get sucked into. They get into this bad habit of buying leads and then ignoring all of the other things that we just talked about. Okay, leads are a shortcut, and you know, shortcutting is usually good, but it can get you in a bad habit of not maintaining your book, not maintaining the relationships you build, not leveraging, you know, the past trust building encounters you've had with people to maximize, you know, the potential that you have with those relationships. You know, we see it a lot, far too often with agents that they ignore other things like follow-up and building relationships. They forget about those foundations, and really just buy leads every year, paying money for a brand new group of people rather than building a business and expanding on their existing relationships and trust that they've already built. So again, I'm not saying don't buy leads, okay? It's just, it's better to take the organic growth approach and then fill in the gaps with the leads. Okay, leads should not be the first thing on your mind when you're talking about how to grow your business. They truly should be the last.